Now, in our mice that were infected with influenza, we did find IL-33 in the lungs. And you can see that this increased within 24 hours of infection. And this was maintained for at least 7 days after infection. Now, the cell type that turned out to be producing most of the IL-33 turned out to be these alveolar macrophages. And this was shown by flow cytometry and intracellular cytokine staining, so that after infection, shown by these solid bars, there was a significant increase of these IL-33 positive cells compared to prior to infection. And this production by alveolar macrophages is consistent with studies in humans showing that influenza does infect alveolar macrophages during influenza infection. Now, other cell types, including these interstitial macrophages, produced some IL-33, as well as dendritic cells in the lungs produced IL-33. And these CD45 negative cells include epithelial cells, which, as you see, have a fairly high background production of IL-33, but this did not increase on influenza infection. Now, this production of IL-33 by alveolar macrophages was confirmed by some in vitro studies. We can take alveolar macrophages from these mice from naive mice, and we can infect them in vitro with influenza. With a multiplicity of infection of 5 here, you can see that there was a very significant increase in messenger RNA for IL-33. Now, the role for IL-33 was confirmed by studies looking at SD2 knockout mice, which is the receptor for IL-33. And in these SD2 knockout mice infected with influenza, you can see that these mice failed to develop this airway hyperreactivity response, shown by these green symbols, indicating the role for IL-33 and its receptor. Here are the control mice that develop severe airway hyperreactivity. Now, this requirement for IL-33 and its receptor appeared to be very specific for influenza infection, because in this allergen model, the SD2 knockout mice, sensitized and challenged with ovalbumin, developed severe airway hyperreactivity, shown by these red symbols. And so this indicated that this IL-33 SD2 axis was specifically required for the influenza-induced airway hyperreactivity response, but not for the allergen-induced airway hyperreactivity response. Now, the next question was what cells were responding to IL-33? And as I mentioned, it was known that Th2 cells, eosinophils, mast cells, and subsets of NKT cells can respond to IL-33. But about a year and a half ago, there were 4 papers that came out simultaneously describing a new cell type called Nuocytes by Andrew Mackenzie, natural helper cells by Shigeo Koyasu, innate helper type 2 cells by Richard Loxley, or multipotent progenitor cells by David Artis. Now, in these different papers, they describe slightly different cell surface markers of these cells, but in general, they were non-T, non-B cells. That is, they were lineage negative cells that they did not express the T cell receptor or B cell receptor or CD4 or CD8. They expressed variable amounts of c-KIT, SD2, which is the IL-33 receptor we talked about, and IL-17RB, which is the receptor for IL-25, another innate cytokine, as well as SCA1, which is stem cell antigen 1. But the most important thing about all of these papers is that they described a cell type that produced very large amounts of IL-13 and IL-5. And in these papers, they described these cells as being present in the intestines in the context of Helminth infection. And over the past year, these cells, called Nuocytes or natural helper cells, have been shown to belong to a family of evolutionarily conserved effector cells called innate lymphoid cells. Now, let me just say a few words about innate lymphoid cells. Now, you know a lot about the prototypic innate lymphoid cell because that's the NK cell, which is present in the peripheral blood at fairly high concentrations. As you know, they produce gamma interferon. The Nuocytes are now proposed to be called innate lymphoid cell type 2, or ILC2 cell. As I mentioned, produces IL-13 and IL-5, but it does not produce IL-4. IL-17 innate lymphoid cells have been described. They are called ILC17 cells. And there's also IL-22 producing NK22 cells or ILC22 cells that produce this innate cytokine, which is very important at mucosal surfaces by inducing the production of antibacterial peptides. And there's another innate lymphoid cell called lymphoid tissue inducer cells, which are involved in lymphoid organogenesis. Now, these innate lymphoid cells describe a universe of cell types that may be parallel to the universe of CD4 T cells, which I'm sure you know much more about. These include, of course, Th1 cells, which may be comparable to the ILC1 cells, Th2 cells, which, as we mentioned, produce IL-4, IL-5, and IL-13, which may be comparable to these ILC2 cells, Th17 cells, comparable to these ILC17 cells. Th22 cells have also been described, may be comparable to these ILC22 cells, and so on. Now, as you may know, the CD4 T cells have been shown to derive from a common precursor cell, and this has also been shown to be true for innate lymphoid cells. They come from a common precursor cell, which is characterized by this transcription factor ID2, and this cell differentiates along a number of different pathways depending on the cytokines that are present, including IL-15 and IL-7 and other cytokines as well. Now, for this talk, I'm going to be focusing primarily on these ILC2 cells, or Nuocytes, which I mentioned produce large amounts of IL-13 and IL-5, and which have been shown to be have been shown by other groups to be present in the intestines in the context of helminth infections. So we asked if these Nuocytes would be present in the lungs and also important in the context of at least some forms of asthma. So the first thing we did was to look into the lungs of mice, and we focused on lineage negative cells, which were ST2 positive. And you can see that this is a population here in the uninfected mice. You can gate on these cells and then stain for SCA1, and there's a very low number of these cells in the lungs in the naive mice. However, after infection, you can see that the number of these SCA1 positive cells increases quite significantly over time. This is day 6 of infection, and this data are summarized on the next slide, as shown here. The number of these Nuocytes, or natural helper cells, ILC2 cells, are fairly low in the naive lung, and these increase over time with infection and peak around day 6 of infection, again around the time when airway hyperreactivity peaks. So the number of these Nuocytes in the lungs peaks on day 6 of infection. Now, it also turns out that the major IL-13 producing cells in the lungs are these Nuocytes, these ILC2 cells. And you can see that by these flow cytometry studies by gating on IL-13 producing cells, which is on the x-axis here, either in the mock-infected mice or in the infected mice. And you can see that the lineage negative cells here, lineage markers are on this scale, lineage negative cells are the major producers of IL-13, whereas the lineage positive cells, which includes T cell receptor and this Th2 cells, are really the minority of the cells in the lungs that are producing IL-13. Now, we also showed that these Nuocytes are producing IL-5, either in the BALB/c mice or in the RAG2 knockout mice infected with influenza. You can gate on these lineage negative cells and then stain for IL-5, which is on the y-axis here, and these are the Nuocytes that are producing IL-5. And these studies are done by intracellular cytokine staining. You can also isolate IL-5 in the lungs of these infected mice, and this also peaks around day 4, day 5 of infection. Now, I mentioned that the number of eosinophils in the lungs is relatively low or non-existent in the infected mice, so we believe that the Nuocytes are producing IL-5 during this influenza infection, but the eosinophil recruitment into the lungs is blocked by the presence of high levels of gamma interferon. Now, the studies showing the importance of these Nuocytes in influenza infection were these depletion and reconstitution experiments. So if you deplete these Nuocytes in the RAG2 knockout mice that are infected with influenza by treating the mice with this anti-Thi 1.2 monoclonal antibody that depletes all of these Nuocytes, you can see that this totally blocks the development of airway hyperreactivity, shown by these green symbols, whereas in the control mice, severe airway hyperreactivity develops. In the reconstitution experiments, we used IL-13 knockout recipients, which, as I showed you before, failed to develop this influenza-induced airway hyperreactivity response. But if you transfer Nuocytes from wild-type mice and then infect the mice with influenza, this fully reconstitutes airway hyperreactivity, shown by these red symbols. In contrast, if you take Nuocytes from IL-13 knockout mice, adoptively transfer them into the recipients that are then infected, you can see that this fails to reconstitute airway hyperreactivity with influenza. So this indicates that IL-13 producing Nuocytes play a major role in mediating the influenza-induced airway hyperreactivity response. Now, there are a number of questions we can ask using this model. For example, are Nuocytes required for the clearance of influenza infection? Now, in the wild-type mice, you can see that when the mice are infected, there's a very rapid increase in the plaque-forming units, which is assayed by RT-PCR after infection. This peaks on day 3, and then is cleared within a week, and certainly it goes down below background levels by day 14. And this clearance, though, appears to be due to adaptive immunity, because in the RAG knockout mice, you can see that there's a significant rise early on, but there's a failure to clear this infection, indicating that adaptive immunity, antibody production, and virus-specific CD8 T cells are required to clear influenza from these mice. Now, in the ST2 knockout mice, which have defective Nuocytes, there may be a slight delay in the clearance of influenza, but you can see that there's a rapid clearance after 7 days of infection. Model was that influenza can infect alveolar macrophages. It probably also affects and infects epithelial cells and these interstitial macrophages and dendritic cells. These then produce IL-33, which goes on to activate Nuocytes, these ILC2 cells, which then can mediate the development of acute asthma. Now, over the past year since we described this model, a number of other people have been looking at Nuocytes, ILC2 cells in mouse models of asthma. This paper, published earlier this year, showed that with a protease allergen, and as you may know, most good allergens have protease activity, that in this model using papain, Nuocytes were a critical source of Th2 cytokines. And in this model, Tim Halem proposed that protease allergens can damage the airway epithelium, and these then release IL-33 to activate these natural helper cells that he called them, or Nuocytes or ILC2 cells, which then can mediate the development of airway inflammation. Now, there's another paper showing that Nuocytes are a source of amphiregulin, which can restore airway epithelial integrity after influenza infection. So this suggests that Nuocytes may play a role in the homeostasis in the lungs. There's another paper showing that Nuocytes can infiltrate the lungs during an allergen challenge model, but these Nuocytes, though, are not required for the development of allergen-induced airway hyperreactivity, as I showed you earlier. Now, we've shown that Nuocytes can interact with NKT cells and alveolar macrophages to induce airway hyperreactivity, and that's shown on this slide in a model where activation of NKT cells can induce airway hyperreactivity, as shown by these pink symbols, where mice are given alpha-galactosylceramide, a glycolipid, which activates NKT cells. If you treat these mice with an anti-ST2 antibody to block the IL-33 pathway, you can see that this blocks the development of airway hyperreactivity. If you give alpha-gal-cer to IL-13 knockout mice, they fail to develop airway hyperreactivity. But if you adoptively transfer these Nuocytes or natural helper cells and then challenge the mice with alpha-gal-cer, this fully restores airway hyperreactivity, indicating the important role of Nuocytes in this model of airway hyperreactivity. So these studies indicate or suggest that there's a number of things going on in the lungs. Epithelium can sense glycolipids, can sense allergens or infection. This then results in the production of IL-33, which can activate subsets of NKT cells, these innate ILC2 cells or natural helper cells. But they can also, IL-33 also activates basophils, mast cells, and eosinophils, since they express the SD2 receptor. And all of these cells together can interact and result in more severe airways disease. Now, an important question is, are these Nuocytes important in human asthma? And interestingly, a number of years ago, in 2009, Guy de l'Espèce published this paper showing that he could find a non-T, non-B cell expressing CD34 and producing IL-5 and IL-13. So IL-5 is on the x-axis here, and these cells are positive for IL-5, and this is IL-13 on the x-axis, so these cells are positive for IL-13. These were present in the sputum of asthmatic subjects, but not in normal subjects. And so this suggests that these Nuocytes, that these cells are indeed Nuocytes and present in the lungs of patients with asthma. And earlier this year, last year, Hergen-Spitz showed that these Nuocytes are present in human nasal polyp tissue, but not in non-inflamed nasal tissue. So these studies suggest that these Nuocytes are indeed present in humans and could play a very important role in human asthma. So on this summary slide, what I've told you is that asthma is a very heterogeneous inflammatory disease of the airways. These mouse models can help us sort out the heterogeneity in asthma by pointing out very specific pathways that do occur in humans that would be very difficult to dissect in the complex environment of the human lung. I showed you that infection with H3N1 influenza A virus resulted in severe airway hyperreactivity, and this could occur in the total absence of adaptive immunity. The influenza virus induced these alveolar macrophages to produce large amounts of IL-33, and this IL-33 then went on to activate these Nuocytes, which then produce IL-13 and were required for the development of airway hyperreactivity. So these studies suggest that targeting these innate lymphoid cells may provide new and effective therapies for at least some forms of asthma.